So speaking of wound healings, what are wounds? The def so the question of is the second topic on general surgery is wounds, the classification of wounds, and the healing disorders, and temporary versus definitive treatments in wounds. And so, what's the definition of a wound? The definition of a wound is basically when you have a uh, a tear or an opening within the skin mucosa that is due to an external injury. So, speaking of wounds, what are wounds? Wounds are when you have anatomical lesions within the body that causes an anatomical deformation of the tissues, skin, etc. And you can you can classify it into things like acute, which means that the wounds will heal within 4 weeks, or chronic wounds, which usually takes longer than 4 weeks to heal. We can also have open wounds versus closed wounds. Um, Closed wounds can also have a different degree of contamination of the wounds. Um, so, speaking a little bit into more depth concerning the wounds. So, open wounds. So, what are some types of open wounds? We can have lacerations, which means that it's a tear within the tissue. Usually causes jagged edges within the borders of the wounds, and there may be necrotic tissue that must be debrided for healing to take place, and there may be some contamination. You can also have incision wounds. Incision wounds are usually more wider than deep, and it's usually caused by things like knives. And usually the wound borders are very clean, and there's also less contamination, so usually the healing will be better. You can also have a puncture wounds, which are due to things like sharp objects, like nails, and these can be contaminated. They're usually deeper than wider, and yeah, can penetrate tissues deep. Things like bones, tendons, muscles, fascias, and muscle sheath, tendon sheath may all be involved and may cause contamination. And some common problems associated with these puncture wounds include things like tetanus or anthrax. This kind of thing can all be due to the puncture wounds. And we can also have human bite wounds, uh, or animal bite wounds, snake bites, um, toxic burns. All these things can be causes of wounds. Uh, on the other hand, we can talk about closed wounds, which include things like contusions, bruising, which are bruising, causes ruptures of capillaries within the membranes of the tissue, and usually you can tell by the color of the bruising how severe that bruise is. So if you have a things like if you have a deep dark black or dark blue, then this usually means that the contusion is very severe. If you have yellow color, then this also means mildly severe. If you have light blue to light purple, then this may be moderate, and if you have really light color, then it's usually very mild. And apart from this, we can also talk about crushing injuries. So crushing injuries usually happens in things like disasters where heavy objects will compress your tissue for a prolonged period of time, causing destruction of the muscles, myolysis, rhabdomyolysis, and these things may eventually lead to shock. um, and myoglobinuria. It may lead to a release of intracellular ions, which may cause arrhythmias and heart problems. The myoglobin may also damage the renal tubules and the glomeruli, causing renal failure, acute renal damage. And in addition, it may also cause a compartment syndrome, means that the bleeding will cause a compression of the collection of fluid within the fascias, which causes an increase in the pressure within the fascia, causing reduced perfusion into those tissues, causing necrosis of certain segments of muscles. And we can also classify it according to things like the mechanism of injury. If it's chemicals like alkalis or acid, it can be caused by trauma. It can be due to electricity or heat burns. It can also be due to radiation. And so, in terms of colonization, there can be other various different types of colonization. So it can either be clean, which means that there's no like bacteria inside it, there's no contamination in the wound, or very minimal contamination. It can be clean and contaminated. Okay, so this is usually referring to surgical techniques. And so when you have things like surgery, then like a wound can either be clean, if there's no like spillage of viscera, things like the guts, there's no content spilling from there. It can be clean contaminated, meaning that it was an elective surgery, for example, elective cholecystectomy, and that there was planned, so therefore there was no spillage from any of this bile duct or intestinal organs. There can also be things like contaminated surgical wound, which means that, so for example, an emergency appendectomy, there may be spillage of fluids from the appendix or from the gut, causing contamination basically. And there can also be so other types of inflammation or contamination, meaning dirty surgical site, and this means that there's a lot of spillage and there's a lot of contamination, and it can be other types like colonized, and other types can include things like if you have colonized, so it's colonized with the bacteria, and so these are some different types. So the other types of healing. The healing takes place in certain steps, actually 4 different steps. First, after there's a wound opening, there's the inflammatory phase where there's inflammation happening with hyperemia, pain, dolor, swellings due to the edematous fluids and the transudation. There may also be inflammatory cells surrounding dead debris or infectious organisms, and phagocytosis, and there's going to be pain as well. Then there's the proliferative phase after the inflammatory phase. This is where there's a deposition of things like collagen due to fibrocytes releasing all these type 1 collagen, and there's going to be some scarring there. And after this proliferative phase, the tissue and fibroblasts and myofibrocytes, then there will be things like remodeling. Remodeling basically means that these collagens and these myofibrocytes will reorganize itself into proper alignment. Things like elastin will not recover, so, which means that the elasticity of, for example, skin will not be recovered after a wound. But there can be other types of, like I said, after this proliferative phase, it will be things like there's this remodeling phase. So we talked about things like reorganization of these myofibroblasts, and next I want to talk about things like what are the factors that influence healing. Things like infections can influence healing. Your nutrition status can also influence the healing of your wounds. You can also have underlying conditions like diabetes, um, hypertension, which can all influence this. And yeah, so like we said, the wound can actually be determined whether if the factors are either reversible or non-reversible local, meaning that the reversible ones are the ones that are things like hematomas, seromas, things that you can just remove, while the non-reversible ones are the ones that are underlying conditions like diabetes and other hypertension, and any other disorders. So let's next I want to talk about some complications. So speaking of complications for healing disorders, there are hypertrophic scars. So what are hypertrophic scars? So when you're injured, right, sometimes the healing is not happening properly. Why? It could be genetic factors. It could be some in some rare instances this can happen. And so in one instance we can have hypertrophic scars, and this is when you get scarring that is defined within the borders of the wound, but it's still hypertrophic. Other examples are things like keloids. Keloids are slightly worse than hypertrophic scars, in a sense that it's more common in Africans and less common in other races. It can have things like, so grow over the borders. It can be severe scarring and a lot of granulation tissues, maybe loops. And the treatment methods for these tend to be things like compressing or surgical removal. Surgical removal is usually not really good, especially in keloid scar, because they tend to recur. You can also inject corticosteroids or give compressions, like gel compressions, things like this to prevent things like ulcers, pressure ulcers. And treatments. So what types of treatments are available for these patients? So some treatment options which are available include things like this primary closure, secondary closure, and tertiary closure. Some primary closure, this is when you are capable of closing a wound because it is not infected, and in addition to that, we can also have things like this is basically infection. There's no hematomas. Like the joining of the two edges are very clean and things like this. Secondary closure means that you keep the wound open for a while. For and this the intention for this is to let the uh, so repeating the second intention healing. So in second intention healing, we have the the wound is not closed, meaning that the so it's left open for a while, right? And then after it's left open for a while, then what tends to happen is that there is a things like necrosis, or not even necrosis, like just scarring of the surface, drying, this kind of thing. Okay, and after that happens, then you will basically close it after that. And finally, for tertiary, what happens here is that you leave it open for a while, and you may insert things like antibiotics um, and other gauze soaked in antibiotics, and you basically let the wound sort of treat itself because there's things like colonies within um, the wound. So you first try to treat this wound first, and after you treat the wound, then finally you can close it. So these are some different types of treatment methods that you can use. Um, and uh, yeah, so there's also things like first intention healing, second intention healing. First intention healing means that it's uncomplicated, it's not contaminated, meaning that there's no bacteria, there's no debris inside, and as a result, there's no scarring, there's clean adhesion, and then as a result, there's going to be proliferation of the fibroblasts, and then releasing collagen, and then there's release of VEGF, vessel endothelial growth factor, and this will bridge the two edges, and then eventually it will form, and then there will be no scars. So that's first intention healing. For second intention healing, it's usually a little bit more complicated because of the contamination, and so when you have this contamination, then usually the wound becomes more or less like complicated, and as a result, there's a poor wound healing. There might be scarring. There might be more inflammation, more destruction. So these are some things to remember about intention healing. So how do we treat? What are some methods of treatments? So we have definitive, and then we have a more transient method of treatments. And so the transient method of treatment would include things like so basically there's different types of dressings you can cover it, and one of the things are like debridement, meaning that you get rid of the necrotic materials that are within the wound, which can prevent healing and complicate the healing. Treat the seromas and hematomas by removing those. So some different methods that you use for treatments. So things like different types of dressings, like semi-permeable dressings, meaning that it will prevent the release of gas, but will prevent the passing of fluids. You can have certain powders and gels. You can also have things like negative vacuum assisted dressings where you apply negative pressure for the wound opening, which allows angiogenesis to improve more, and it's indicated for things like different types of wounds, You can also use skin flaps or skin grafts if the wounds are large. Skin flaps are usually those with vascular supply intact, and uh, it's uh, it's usually connected to another part of the body, so you have to basically stabilize the body towards that other part of the scar. And other types include things like suturing the wound, or and it's also important that you give tetanus prophylaxis, because if the patient is not immune to tetanus, which is due to a bacteria called Clostridium tetani, very common in wounds in farming or soil related puncture, etc. And you might give toxoid and antitoxins or booster shots or vaccines depending on the status of the patient, his immune vaccination status. And so these are some things to note about when regarding about wounds and different types of wounds and treatment of wounds and healing and all this aspects. Speaking of skin flaps, it can either be local flaps or distant flaps. It can be free flaps or regional, local or rotational flap, or even skin grafts. Free flaps are usually detached from the blood source, and local flaps. So again, the source of the blood source and the skin is close to the wound, while distant ones are usually more distant. There's more distance in between them. Again, the flaps can have blood supply that are random. It can have different types of tissue inside it, just the skin or just the dermis, including subcutaneous tissue as well, or including muscles, fascias, or even bones can all be possible. Speaking of treatments and dressings, we can have semi-occlusive dressings, like we said earlier, and the whole point is to prevent drying of the wound. Because when the wound dries or scabs or something, it usually slows down the epithelialization and keratinization. As a result, slows down the wound healing process. The same thing goes with powders or um, colloids or hydrogels. They're all there to prevent the drying of the wound. Even you can even use gauze with things like petroleum gels to prevent the drying of the skin, and yeah, there are some things that you can do for in terms of wound healing. And as for wounds for patients with diabetes and all of these things, it's very important to monitor the wounds and constantly check up on the wound, see if it's healing properly or if it's infected. Um, Careful examination is important when it comes to treatments with diabetes, and sometimes you might actually have to intervene with surgery because the wound healing is not, doing so well, and the conservative methods with these creams and these petroleum gels, all these is not really helping, and it might require some surgical debridement or even amputation of certain limbs if if getting severe or not healing properly.